Municipal Association Board of Directors. Additionally, she is the founding chair of GMA's Children and Youth Advisory Council and serves as immediate past chair of the Environmental Justice Working Group for the U.S. Environmental Protection Agency's Local Government Advisory Committee and continues to serve on the committee. She serves as a board member of the Erythropolis Atlanta Alliance, Clayton State University College of Art and Sciences Advisory Board, and is an esteemed member of Delta Sigma Theta sorority. An advocate for children, Mayor Holiday Ingram has held strategic leadership roles in Georgia's 4th largest school district, and she and her husband, Willie Ingram Jr., are the proud parents of their daughter, Nia. Please help me welcome Mayor Holiday Ingram.
Good afternoon. Thank you so much for the invitation, and the lunch was amazing. So thanks for the time for that. This is my first time at the Emory Conference Center. So I appreciate the opportunity to speak with and be amongst what I call the choir, like people who really understand the importance of people, serving people, and how everything is connected, the intersectionality that this organization recognizes between not just physical health, but planetary health is critically important, as well as environmental justice. And so as I was thinking about what I could share, I always say there's no point like East Point, right? And I say that because I want people to understand that I believe that we're a model for all things just, fair, and equitable. Like, we really care about and value all people. And I also say it because I want people to be like, why did she say that? I'm like, well, come check us out and see. We have a lot of cool, amazing things happening, but not just impressive things, impactful things. But as I think about your work and what you do, and then East Point, I want to share a story about how my commitment to this work really manifested, or really I realized that it was important for us to do it. So on July 15th, 1912, the East Point City Council, made up of all white men, unanimously voted to require all Black people who lived in the city to live immediately adjacent to 2 fertilizer plants, an oil plant, and a chemical plant. It smelled so bad they called it Stink Town. And if you wanted to stay in the city, you were Black, you had to stay there or leave. So really forcing environmental injustice and people being required to live in a toxic environment. Unfortunately, that spread to other areas of the city. So East Point is a little over 38,000 residents. We're just under 15 square miles. We're landlocked, so we don't have the opportunity to annex any property in because we have cities on all of our borders. But our forefathers also allowed a paint manufacturing plant to be where right now across the street from residential housing. The paint manufacturing plant has been there for 70 years. And it's big, and there's a lot of fumes that comes from that, right? So around the corner is a wood pole manufacturing facility. And they're residential, like nestled all around and within it. And so we have been fortunate to partner with Partnership for Southern Equity, and created the first equitable growth and inclusion strategic plan I know in the region, probably in the state. We also have a city urban agriculture plan, and those 2 plans positioned us to be the focus of Morehouse School of Medicine's grant from the Office of Minority Health to advance health equity in East Point. That was $375,000 for up to 3 years, for a total of $1.1 million. Megan Douglas is the Morehouse lead, was the Morehouse lead for that, and the work that they did was so great, they gave them an extra $100,000. So we had $1.2 million, and we started infusing health equity into our comprehensive plan, right? Because the cities, land use and zoning, that decision of requiring people to live in an environmentally toxic environment was a land use decision. Participating in that cohort or that program through Morehouse School of Medicine and that grant, we became a part of the City Health Dashboard. So you all know you can get health data at the state level, at the county level. It's very hard to get it at the city level, right? Generally, we're trying to like disaggregate or speculate based upon those. So we now have data at our local level for the city of East Point. So I was sitting in a class we were going over data, the session on data. We were looking at the city health dashboard information for East Point, looking at like hypertension and diabetes and the rental rates and socioeconomic factors. But there was one diagram or one map that addressed life expectancy. And on this life expectancy map, the darker the hue of blue, the shorter the life expectancy, right? So it was a map of the entire city of East Point, and it was broken out by census tracts. So each census tract had a color. On this map, there was only one census tract that had the darkest color blue. So the lowest life expectancy, less than 70 years of life. And I'll give you one guess as to what section of the city that was. What was formerly known as Steamtown is now known as East Washington. And of course, they made lemonade out of lemons. There were doctors, lawyers, an amateur baseball league and all of that came from that area. But a decision made over 100 years ago, over a century ago, is impacting the health of people in our community today, right? And so I want to say thank you to you and your organization for the work that you do to understand the intersectionality, right? If we're not healthy, we're not here. If we're not well, we can't do anything. And there are a lot of things that impact health. I'll lead with this. Megan, who's like the person who basically helped me understand health and understand that primary care is foundational. People need to be connected to a primary care home. And people who find themselves in emergency rooms, and in our whole country and our state, we get it very upset when hospitals close, and that does matter, right? We need to have an accessible, affordable, high quality, comprehensive healthcare system that includes acute care. So when people, I don't care how much insurance you have, if you have an emergency situation, you need to get there and not die on the way. So it needs to be close, needs to be accessible, but we don't need to lead with that. And most people who are in or find themselves at ER are using it for primary care because they believe they can't afford, they don't have insurance, they can't afford to connect to a primary care provider. And so that's important because 80% of health outcomes are actually determined by social determinants of health, not health treatment, right? So if we know that, why aren't we doing more to really understand intersectionalities and deal with the social determinants of health to help people be healthy? So again, thank you for the work that you do around not just ensuring as nurses that people are healthy when they're getting treatment when they're there, but understanding that there are some things that also impact health that are beyond all of the tools that you have in a medical office or in a hospital, right? That are in the air that we breathe, in the communities that we live in, and that we can do something about that, and that we have to. And regardless of what's happening within our country at this time, climate change is real. There's a real impact on our lives, on the health of everyone. And I encourage you to continue to be champion, to continue to do the work, not focus on the quantity of people, but it's the quality. Margaret Mead said, never doubt that one person can change the world. Because in fact, that's the only thing that has, right? Like one person multiplies 6 people to 3 people. And just make sure that we continue to support each other and be the choir, be the community, be that force that our community needs right now to find those real solutions that will have generational impact. So again, thank you for this opportunity to speak with you this morning. Thank you for all that you do. Know that I will forever be a part of your choir. You can reach out to me at any time because this work is important. And I thank you so much for all that you do.
Thank you so much, Mayor Holiday Ingram, for that amazing opening to kind of frame our day and our discussion throughout this afternoon. I'd like to welcome our keynote speaker for today, Dr. Neha Pathak, who is a board-certified physician in both internal medicine and lifestyle medicine, and works as chief physician editor for health and lifestyle medicine for WebMD and host of WebMD's Health Discovered podcast. She reports on topics related to lifestyle, climate change, and environmental impacts on health for WebMD and Medscape, and is a regular contributor to Yale Climate Connections. She is a member of the American College of Lifestyle Medicine Board of Directors and chair of the Global Sustainability Committee, and serves on the Medical Society Consortium for Climate Change and Health Steering Committee. Dr. Pathak is also a lecturer at the Yale School of Public Health, where she facilitates coursework on climate change and health, and she's a founding member of Georgia Clinicians for Climate Action. She is board co-chair of Georgia Interfaith Power and Light, a faith-based environmental nonprofit, and she was invited to join the National Academy of Medicine's Communicating About Climate Change and Health Project expert panel. She lives in Atlanta with her husband and children. Please welcome Dr. Pathak.
Thank you all so much. Thank you so much, Mayor Halliday Ingram. I will say that when I moved from Jersey, I am a Jersey girl at heart. The first place I moved to was in Atlanta. My first clinic was in East Point, the VA satellite clinic. So I know it well. And my second kid was basically Subway sandwiches that I had at the East Point Subway. Let me see if I can advance my slides. Think I can't advance them. All right, okay, we're back. All right. So thank you again so much for your kind invitation. Very excited to be with you all today. Please do enjoy your lunch as we chat, because I'm hoping that this is something that we are co-creating together. I have no disclosures, but I will say that I give all of my talks as a mother, as a primary care physician, and as a spiritual person who is looking to find ways through all of these different ways to benefit human personal health and planetary health. And a note on language, I think that we are all here together to try to do something positive for the world. If I misspeak or use the wrong term, please, I offer you my apologies in advance. So our objectives today are essentially to co-create a story of how we can bring other folks into this conversation. As the mayor mentioned, we are the choir, and we are trying to share this complicated, scary information with a broad group of the population that is not necessarily engaged. So one of the ways that I have sort of thought about bringing it home is to talk, especially with healthcare professionals and people that are interested in health, about ways that the things that we're doing to improve our health personally with regard to lifestyle changes can also be robust benefits, can also provide robust benefits for planetary health. So that's sort of the angle I come at it with. Now, this is what most people think of when they think about climate change, or when you go to a climate change talk, this is probably one of the first images you see. It is talking about greenhouse gases at the top, all the way down at the bottom are the cascading impacts on health. There's overlapping, complicated, complex interactions, and it is too much. It is overwhelming. It is very hard to think about yourself as an individual doing anything to impact this. It is also very hard as clinicians for us to think about how are we going to bring this into our exam rooms when our exam rooms are already packed and chock full of things that we need to do to improve health. So I apologize. See, I told you apologies would be necessary. Apologize for bringing this as my first slide, and we're gonna strike it from the record and start with this. This is something very much in our purview. This is one metric we use to assess the health of our patients. And we see that there is a normal cadence. There are highs, there are lows, there are dips, there are valleys, but in general, we see a normal cadence. So we would consider this patient generally from this one parameter to be healthy. But we know that when we combine a drastic shift in that normal cadence with symptoms, chest pain, shortness of breath, diaphoresis, sweating, we know a couple of things. One, that we have a closing window of opportunity to do something to help this person in this medical emergency. We also know that we have the tools, the technologies to come together as a team in the emergency room to save this patient. So then allow me to share what we can think of as a planetary EKG. So this is going back hundreds of thousands of years, 800,000 of years using iScore data. And the same thing, we often hear people say, well, carbon dioxide levels, they have changed, they have shifted for hundreds of thousands of years. And we see there is some cadence, there are dips, there are valleys, and over 800,000 years, these things have shifted. But here is where we are today. A major aberrancy with the symptoms of heat waves, floods, wildfires. So again, we know three things. This is a health emergency. We have a closing window of opportunity to save, in this case, a population of people and a sustainable planet. And we have the tools, the technologies to actually come together to protect this patient. So this is very much in our lane. As health professionals, we need to be part of this conversation. And it's not just here in this room that think so. This is a global agreement amongst health professionals that we must take action as health professionals to talk about climate. But beyond climate, we need to be thinking about other planetary threats, from biodiversity loss, from the war on nature, losing all of these natural spaces. So just a quick point on planetary health. I think of climate change as one piece of planetary health that is aberrant within a larger umbrella, where we're also thinking about soil health, where environmental health, pollution, the health of our oceans, the health of our waters, all the health of our air, all of this together. Without those healthy pieces, the human being and human populations cannot maintain their health. So this is from 2009. Scientists developed this framework and looked at several planetary boundaries, from climate systems to ocean systems, atmospheric pollution systems, land water, freshwater use. And in 2009, we were in safe operating boundaries for the majority of them. 3 had been, we were sort of considered outside of the bounds. So the green is below the boundary, the yellow to orange zone is a zone of uncertainty. And where you see red is where there is a high degree of certainty that we are living outside the bounds of what the planet can sustain. Then when we fast forward to 2023, 2024 looks even worse. We are well outside the climate barrier, our soil health barrier, freshwater barrier, land use change, the loss of biodiversity, and chemical pollution in our environments. So, and there are many, many drivers for, we talk a lot about climate change, but I do want to give a nod to the importance of biodiversity loss. We are learning a lot more about how this impacts our health individually, but we know as populations, when we lose biodiversity, we lose access to potentially the next life-saving medication. We lose access to lands and ecosystems that are protecting us from climate driven storms and extreme weather events. So let me just bring it back then to focus the rest of our time on climate change. So we have a lot of science and a lot of understanding around how, from the innermost to the outermost sections, that the change in our climate is impacting our local environments, air, extreme heat, severe weather, and that out in the very outside box, that they have downstream health impacts. Here's another way to think about it. So think about regional impacts. So here in the Southeast, one of the things that we can be that we are seeing more and more of extreme heat days, poor air quality in our coastal areas, coastal flooding. We're seeing mental health impacts. We're seeing impacts on new vector-borne illnesses. So in Florida, local transmission of dengue. We used to have malaria endemic to our region, but there is always a concern if we continue to heat as we are, that we're going to be needing to think about new vector-borne illnesses in our region. Beyond that, I think in the intro it was mentioned that
That I don't know, but it's on the 4th floor.
lifestyle
So
medicine.
let me
So
show you
what
where
does
the
that
elevator
mean?
is.
So that means that I
The
am
4th
very
floor.
concerned beyond being
4.
able to prescribe pharmaceuticals to people. I believe that it is really important that we prevent chronic disease and chronic
You're gonna go
conditions
up here.
through very
4 right
simple
there.
yet very difficult lifestyle interventions. That means thinking about food and nutrition as medicine. It means thinking about physical activity as medicine. It means thinking about sleep, stress management, avoiding risky substances, and being socially connected as medicine. And we know now, the science is very clear, that 80% of our health, of the reduction of chronic disease, happens if we focus on these 6 pillars. But we also know very clearly that every single one of these pillars that prevents chronic disease is being crippled because of climate change and planetary threats. We see it in our agricultural community here in the Southeast. So all of these foods that we recognize as healthy, our fruits, vegetables, legumes, are devastated with crop loss because of extreme weather events or extreme heat. Again, sorry. I told you I'd have to apologize multiple times during this presentation. Very complicated slide, but essentially I'm going to eliminate the central pieces of it. But we know that as carbon dioxide levels increase and our soil nutrient health diminishes, the downstream impacts on staple crops in our diet that are healthful, wheat, rice, legumes, vegetables, diminish with regards to their zinc content, their iron content, their protein content. So not only do we have less access to healthful foods, the foods that we have are diminished in their nutrient quality. Physical activity. It's very hard for us to prescribe physical activity when our patients are facing flooding, wildfire smoke, extreme heat. Sleeping. So we did talk about health inequities, and we recognize that there are urban heat islands. So not only as temperatures increase, does it become harder to get a full night's rest, which we know has major impacts on coronary disease, metabolic syndrome. We know that there is an unfortunate divide in those who have tree canopy and those who do not have access to that tree canopy. Those who are living in regions of urban concrete, where there are urban heat islands, so the impacts on their sleep are even worse. Stress management, we recognize as a core pillar, impacting all of the physical health parameters that we think about when we talk about chronic disease. It is we are seeing stronger and stronger evidence of high temperatures and heat impacting our mental health, from our stress responses, our coping behaviors. And then social connection. We know that social connection is key to performing healthy lifestyle choices, and it is very difficult to see communities being devastated and then forced to evacuate, losing not just their homes, but their social connection. And we know by 2050, 200 million people are going to be thought of as climate refugees. And then finally, we'll talk about our exposure to toxic or substances. So with elevated temperatures and climate change, we're seeing some studies show rising rates of drug use, alcohol disorders. And a lot of this comes to, again, another complicated image, which is essentially showing that as the stability of our climate, the stability of our social systems disintegrate because of climate shocks, we are then more likely to see maladaptive coping behaviors. So I think we have now seen that it's very important for us to be sharing this story as health professionals and people who care about health. But there is also a major equity dimension here. So if you look at the map on top, what you see is a very bloated United States of America, a very bloated Europe, Australia, a little bit larger. And then when you look on the map on the bottom, so the map on the top, the bloated regions are where historically these carbon emissions have come from. And if you look at the bottom, what you see is significant inequities on who is bearing the brunt of the climate that is changing. So this map on the bottom, you see a very bloated Africa, you see a very bloated South Asia. And so the people here, just from 4 climate sensitive conditions, diarrheal disease, increases in malaria, increases in extreme heat and malnourishment, suffer to a much higher degree, even though their contribution to these carbon emissions has historically been negligible. When I've given this talk, people say, well, things have changed. And yes, this is true. Things have changed. This is a more up-to-date map of where some of the emissions are coming from. But again, if we think per capita, the US, Australia, Saudi Arabia, Canada are still significantly fueling the fire more than these other nations. And then we talked a little bit about this already, but what we see at a global stage is being replicated at a local stage over and over. This is a heat island map of Washington, D.C., but you could look at this map for any city, USA, and see the same findings. So there are areas where regions, because of redlining, have more heat islands, so those red areas. And then if you layer on top of that, where is the tree canopy? Where are the food deserts? Where are safe spaces for physical activity? This divide replicates itself over and over and over again. So now I promise to come to the happy, helpful part of our time together. So often when we think about what it means to transition in climate solutions, what should we be doing as health professionals? We think about advocacy and advocating for a shift from fossil fuels, which I think is absolutely critical, and where we are able to do that as a group taking collective action, we should. But I think we could do all of these things. We can invest in solar panels and wind power and recycle and compost and still come out on the other side unhealthy with massive amounts of chronic disease. So when we look at solutions, and this is from the Lancet Countdown, from the IPCC reports, the National Academy of Medicine, the World Health Organization, when we're thinking about strategies to build healthy, equitable, climate resilient, and I would say culturally aligned communities, the solutions come back also to the food that we're eating, to safe spaces to exercise and recreate, to ensure that we have social connection, that we're managing our stress in the midst of all of this. So I suggest that in our clinics, in our work, if we cannot do advocacy outside of the time that we're spending in our clinic, we can prescribe healthful behaviors and have massive impacts on building healthy, equitable, climate resilient societies. So I'm going to power through quickly why these solutions and the evidence that these solutions are so powerful. So I am sure that many of you have heard of Project Drawdown. So these are the 100 most effective solutions that we have currently available to us without new technologies that will sort of take that carbon dioxide curve that I showed you and draw carbon actually downward. And when we look at these solutions in the top 10, the fourth most impactful solution is shifting toward a plant-rich diet. And we recognize that this is incredibly beneficial for our health. But if we do that at scale, then we are basically making an impact in terms of the fourth highest robust type of shift that we can make as humanity currently to draw down our carbon dioxide. It's also important because our current food and agricultural system is not only responsible for close to a third of greenhouse gas emissions, but half of the habitable land on Earth is used for agriculture. 70% of global freshwater. Our oceans and freshwater are being polluted because of our current agricultural system. We are losing massive amounts of biodiversity because we are investing on a few types of animals, particularly livestock, which again, apologies for that word, but ruminant animals that we are feeding. And so we're clearing devastating rainforests to make food so that we can feed the livestock that then we will then feed on. And so here's some information about the greenhouse gas emissions across the supply chain. And what we see is as humans from 1970 to 2013 have shifted and massively increased our meat intake. This is not how we traditionally ate. We are seeing that the most carbon intensive food that we could eat are red meat, so beef, lamb. At the lower end, we see peas, bananas, maize, so massively lower carbon footprint. And most of that comes from farming practices so that we can feed these animals, shifting the land use so that we can house these animals, and then that we will then eat. So what is becoming evident is that unless we shift food practices, even if we shifted to solar and eliminated fossil fuels, we still would not be able to reach 1.5, and we still would not be able to reach 2 degrees of Celsius increase in our temperatures. And then to bring the point home, this is a study that looked at not only the health impact of food, but the environmental impact of food. And what we see out as the outliers, unprocessed red meats, processed red meats increase our relative risk of mortality and are the most strenuous on environmental health. And what we know as a healthful diet, vegetables, potatoes, whole grains, fruits, nuts, legumes, much lower down, healthful and lower taxing of our planetary health. So we have a prescription for that. It's called the Eat Lancet Planetary Health Diet, is one way of doing it, but this is nothing more than a modified Mediterranean diet. What we're seeing here is that because of our meat, red meat and dairy and starchy vegetable intake, we in North America are huge outliers. If you looked at this planetary health scale for sub-Saharan Africa, for South Asia, even with their meat intake or their fish intake, they are living within planetary boundaries. We are one of the few regions where our meat intake is drastically higher than what is sustainable for the planet. We also see that if people shift, so this is not a PSA for veganism or vegetarianism, but this is just to say if we shift to a healthful diet and eliminated beef or mutton, half of the global land that we currently use could be protected, reforested, become a carbon sink. If we shifted away from red meat, mutton, dairy, 3/4 of that land could be become a carbon sink and could be reforested and provide for biodiversity. And not much, if you do shift to a vegan diet, we don't see that much of a difference. So I said that I think cultural relevance to a diet is also very important. And we are seeing culturally relevant diet. So it doesn't, if I told my Indian parents to shift to a Mediterranean style diet, they would laugh in my face and they would be like, I don't use olive oil. So we recognize that there are diets that resonate with people throughout the world that are incredibly, incredibly important for our own metabolic and health and longevity, but they also align with what would be considered a planetary health diet. Ultra processed foods, I'm just throwing this in there. So again, these are, we know that, and have growing evidence that they're bad for our health. But we're also seeing that the environmental impacts result from resource intensity, packaging waste. Most of this is in plastic. So the plastic exposure of the food in that ultra processed packaging, over reliance on a few crops, so soy, corn, which also then leads to biodiversity loss, deforestation, transportation, energy use to bring these packets to us where we live. Okay, food. I'm going to move on to our next pillar, our physical activity pillar. So we know that if we can start prescribing to our patients, not just physical activity in a gym, but we help people understand that that can be active transport or short trips that they're taking. So there was a study looking at US cities with the highest rates of walking and cycling to work that showed that obesity rates were 20% lower, and diabetes rates were also 20% lower compared with cities that had the lowest rates of walking and cycling. So this study modeled what it would look like for a Midwestern area where biking was not the norm. But if they did start shifting to biking trips for distances less than 2 miles, which are close to half of the car trips we all take, it would decrease carbon dioxide emissions, save close to over 1,000 lives every year, and save $8 billion of healthcare costs from better air quality and less sedentary lives. So I will say, when I read this study, I looked at my own life to see where is my less than 2 mile trip, which is every day a trip to take my COVID baby to her daycare. Back and forth is less than 2 miles. So we started a group of moms in the neighborhood, and we walk our kids to that daycare, and then we walk back to the neighborhood. And we talk about our husbands, and we get out all of our stress. So it's a multi-solving solution. This is a similar study done in Sweden, which showed, again, modeling just for people. What they did there was looked at people who were healthy enough to bicycle, whose commute was within a 30-minute bicycle trip. And they saw that over 100,000 people could potentially commute by bicycle if they wanted to, which would save hundreds of lives and reduce pollution exposure. So that is our second pillar. This is our third pillar, avoiding risky substances. So we as clinicians, we're very comfortable with looking at the global disease of risk factors for tobacco, which is number 3 on this list. For alcohol use, we are very well aware on how to screen, how to talk to our patients about this. But I would suggest, and I think a lot of us agree, that we should also be thinking about how to talk to our patients about the 4th leading global burden of disease risk factor, which is air pollution. We now have a lot of evidence to suggest that, and we know that air pollution comes in the form of that comes from burning of fossil fuels, is a driver of climate change, but also causes local environmental impacts from PM 2.5, ground level ozone, which has direct health impacts. We also know that these exposures can also lead to long-term chronic disease from the same pathways as poor diet or poor exercise. And what we know is that patients see this very clearly in their home. So I know that this is my daughter. When I put her in the middle picture, when I put her on that school bus and it's allergy season, she comes back with puffed up eyes. She looks horrible during allergy season, which means that I see that she does not sleep. She doesn't do well on her test the next day, and I'm giving her much more medication than I would be comfortable with. And this is an easy thing to bring into our clinics. And we know that kids are exposed to diesel exhaust inside of school buses. It comes from the tailpipe and from the engine. And the school buses measurements of exposure to diesel gas inside the bus are 4 to 15 times the level of exhaust as riding in a car in front of the bus. And we know that diesel exhaust has significant health harms. and that diesel exhaust combines with other exposures. So allergens, poor air quality from ozone, influenza virus, traffic noise, and all of these also have combined health impacts. We know that when we prescribe individual prescriptions like checking air quality, avoid exercising during high traffic conditions, shift your transportation routes away from where you know there are high traffic situations, these are individual prescriptions we can provide to patients, but collectively, we can work to advocate for things like retrofitting school buses. So this is some of the work that has been done here in Georgia, when 100% of a fleet was retrofitted to decrease the diesel exposure to children in the bus. There was a 4% increase in aerobic capacity for those children, improved scores on English tests, and some variable improvements on math scores. So just 3 prescriptions. This is helping our patients shift from unhealthful carbon-intensive diets, increase their physical activity through active transport, and talking to our patients about ways to diminish and limit their exposure to air pollution. We have the capability of protecting millions of lives. And I have 3 final prescriptions that we will power through. So nature prescribing, if we are interested in stress management, we are interested in protecting sleep, then nature prescribing, particularly in areas that have lost their tree canopy, to ensure that communities try to protect their tree canopy for their improvements in mental health and sleep can be beneficial. And we know that this is trees are a massive climate and planetary health solution. And then finally, prescribing social connection. We know people that are the most connected are the most likely to make it to survive after a climate event, the most likely to be resilient in the setting of a climate event. And then if we take all of these 6 prescriptions together, we can actually do something for our own healthcare sector. We know that in the US, our healthcare sector is responsible for 8.5% of the emissions, of carbon emissions from the US. So if we are thinking about limiting or impacting chronic disease, then we can make an impact in how much we are prescribing with regards to pharmaceuticals. And so there's a lot of evidence around being able to de-prescribe if we really focus on these healthful prescriptions. And then finally, I'll bring your attention to Drawdown Georgia. So just like Drawdown, our local scientists in Georgia looked at goals that we could look at within Georgia. So 20 achievable goals, and they shared this. So if we think about what we can do as individual prescribers, we can think about healthful nature prescribing. So that's our land sinks, alternative mobility, prescribing physical activity in the form of active transport, prescribing a plant-rich diet, thinking about how people can avoid carbon pollution exposure through electric vehicles, electric school buses. And then these are individual solutions we can also potentially take part in, rooftop solar or recycling. So I think hopefully what we are ending with together is that there is hope that even in the face of what we're seeing with federal inaction globally, there is massive action, and in local communities, we can also take action. So I want to give a shout out to Anne Mellinger Birdsong, who is part of Mothers and Others for Clean Air, and also a founding member of Georgia Clinicians for Climate Action, doing a lot of great work to work with local communities to shift toward to shift away from fossil fuel diesel powered school buses to electric school buses. There are things that we just talked about, what we can do in our clinics, things that you're doing today, organizing for education and collective action, and changing the way we practice so that we have an eye towards health and an eye towards equity. So I will stop there. I have some props. If you guys are interested in more information, please see Anne. She has, if you are here local in Georgia, this is a way to get involved to advocate for shifting for our Public Service Commission to not continue to invest in coal power fire plants. So this is a way to take action on that. and then Climate RX information to help with more information about how we as health professionals can prescribe and inform patients in our clinic about climate impacts. So I will stop there.
Thank you, Dr. Pathak, and thank you to our attendees. I'm going to be introducing, it's my great pleasure to introduce Jessica Mengistab, who works as an assistant nurse manager in mother and baby at Emory Hospital, University Hospital Midtown in Atlanta, Georgia. Jessica graduated with her Bachelor of Science in Nursing from Villanova University in 2015, after earning a Bachelor's of Arts in Sociology from Rutgers University in 2012. In her work and personal endeavors, Jessica aims to marry her passion for maternal child health equity, and environmental justice, while ensuring diverse nursing perspectives are included at all levels of discourse. In her previous work as program manager at Annie, focusing on climate and clean energy advocacy, Jessica worked to engage, educate, and mobilize nurses nationwide on federal climate solutions and clean energy advocacy campaigns that prioritize equity, decarbonization, and sustainability. Jessica will be our moderator for today's panel. Thank you.
Thank you very much for that introduction, Millie. And as a former Jersey girl myself, and also as a resident of East Point, I'm really excited about the distinguished panel that we have to have this discussion this afternoon. So I'm just going to introduce our panelists. We have Gary Harris, who is the president of Sustainability Solutions Group and Institute, SSG&I, which is a consulting firm that provides diverse sustainability, energy engineering, environmental, sustainability, and community development services. The SSG&I consists of two organizations: Center for Sustainable Communities, which is a nonprofit dedicated to making communities cleaner, healthier, safer, and more climate resilient, and HTS Enterprise, which is an engineering, policy, research, and education. Mr. Harris has more than 3.5 decades of experience in the energy, climate, and environmental field. He's worked tirelessly to advance numerous local, regional, and statewide coalitions focused on advocacy, policy development, and collaborative problem solving in areas including clean energies, climate transportation, health disparities, housing, pollution, and community development. Mr. Harris is a graduate of the 2009 class of Leadership Atlanta, 2013 class of the Institute for Georgia Environmental Leadership, 2014 class of Regional Leadership Institute, and a graduate of the U.S. EPA Environmental Justice Academy in 2016. He is a co-founder of the UN Regional Center for Expertise in Education for Sustainable Development, Tech Academy, and the National Environmental Justice Institute. Thanks for joining us, Mr. Harris. Then we have Kaya Stanford. Kaya is the Georgia Field Coordinator at Moms Clean Air Force. She is a passionate advocate and organizer dedicated to creating equitable and sustainable communities. With an extensive experience at the intersection of environmental and social justice, Kaya brings a unique blend of grassroots organizing and strategic leadership to her work. Kaya has worked on local, state, and national campaigns to increase civic engagement and advocate for environmental and social causes. As an organizer and content creator with organizations such as Care in Action, New Georgia Project, and the League of Conservation Voters, she has led efforts to amplify marginalized voices mobilize communities, and advance policies that address systemic inequities. Her work has focused on building coalitions, empowering underserved populations, and driving change in areas where environmental and social justice intersect. Kaya is deeply committed to fostering collective action and creating initiatives that inspire communities to address the challenges of climate change, economic inequality, and social equity. Through her work, she aims to build more inclusive and sustainable future for the next generation. Next, we have Dr. Karen Rawls. Dr. Rawls is a seasoned professional licensed registered nurse, having leadership and teaching experience across a variety of nursing programs and clinical areas. She is currently an associate professor at Hawaii Pacific University School of Nursing. Dr. Rawls received her PhD in education, specializing in nursing education and research from Capella University, and holds an MSN in nursing education, a BSN from the University of Phoenix, an ADN from Georgia State University Perimeter. She is also a scholarly fellow with the Alliance of Nurses for Healthy Environment. Dr. Rawls recently founded the Atlanta Metropolitan Nurse Honor Guard, which provides sentimental services for nurses who have passed away. Dr. Rawls is an accomplished nurse educator. She has led the development and implementation of several nursing schools across the U.S. Her academic experience is vast, having taught lecture, didactic, clinical, and skills lab, as well as NCLEX reviews in hospitals, colleges, and universities across the United States and China. Dr. Rawls is the owner of the Health Education Learning Programs. Her company utilizes organizational platforms to address health equity concerns, provide nursing education, investigate environmental health issues, and promote best practices that foster cultures of wellness. Dr. Rawls serves as the board of AHEC Southeastern Primary Care Consortium, ambassador for American Cancer Society, ambassador for Ebenezer Baptist Church Health Ministry, legislative presenter for the Georgia Nurses Leadership Coalition, and board chair for Rooted Group. She's a life member of the National Black Nurses Association, vice president of the Atlanta Black Nurses Association, president-elect for the Georgia Nurses Foundation, chair for the Georgia Nurses Social and Racial Equity Work Group. Dr. Rawls is a highly sought-after keynote speaker, writer, and workshop leader. She enjoys traveling, listening to music, family time, tutoring novice nurses, and cooking. Finally, we have Robin Busey. Robin serves as the Just Health Director at the Partnership for Southern Equity, PSC, where she leads the organization's health equity portfolio. In this role, she oversees the design, development, and implementation of health equity training, technical assistance, and strategic communications for communities, organizations, and stakeholders working to understand, operationalize, and advocate for health and racial equity. Her work centers on advancing equity across intersecting areas, including climate and health, access to care and services, and reproductive justice. Prior to joining PSC, Robin was a community health strategist at ARCHI, which is the Atlanta Regional Collaborative for Health Improvement, and as a senior research associate at the Georgia Health Policy Center, housed at the Andrew Young School of Policy Studies at Georgia State University. Driven by the belief that racism, not race, is the primary barrier to health equity, Robin is deeply committed to dismantling structural inequities and amplifying community voices, particularly across the American South. Her dedication is reflected in a robust portfolio of work that includes leading community health improvement initiatives across Metro Atlanta and designing programs aimed at advancing health and social equity. Robin brings thought leadership to several collaboratives, panels, and boards, and contributes to publications focused on health equity, climate and health, food security, and healthy and affordable housing. She earned a Bachelor of Science in Biology from Florida A&M University and holds dual master degrees in Business Administration and Health Administration from Georgia State University. A proud native of Waycross, Georgia, Robin currently resides in East Point with her son, Kemp. Thank you all again so much for joining us.
All but one of the almost $1 million that all in our amazing action, right? So making sure that the marginalized individual or Georgia know that this money is in their state, in their district. So that they can educate that this is something that we want to advocate for the economic development of this part of the state as a whole. But also so that they can protect the money that's coming in. $15 billion, almost $60 billion, is not a small chunk of change, right? But if they're not aware of the fact that that's coming into their district, especially under this administration role acts, then they can't advocate for themselves to keep that funding within those districts. The way that we do it on, well, at homes, but as an organizer at large, is making sure that educate them on the policies, educate on the funding that's coming into those districts so that it can directly benefit those communities. Although the example that I'm about to give right now is not an IRA-based funding, I want to say 2.5, maybe 3 weeks ago, Senator Alsop in a hearing with Administrator Zeldin is talking about some of the rollbacks that are happening in Thomasville, which is a rural part of the county, of the state, and how they lost funding under this new administration for a medical center. Again, in a rural part of the state, again, in a mostly Black and brown community. All of these things are happening, not just in Iowa funded projects, but just across the board. So one, letting them know that this funding is available to them, not even available, promised to them under these policies, and making sure that they're able to continue to press on their officials, press on the administration, so that that money actually comes into their districts.
Thank you very much. I wanted to kind of turn that same question over to you, Mr. Harris. Excuse me, given that you have experience working with a wide range of community organizations, like with boots on the ground, and just making sure, like, you have your hand on the pulse of like what's needed within the community. So I wanted to see if you had any thoughts on that as well. And that was just ensuring that frontline and historically marginalized communities are prioritized in IRA-funded projects in Georgia, and kind of to the highest point that they're also just aware of like the vast amount of funding that is available to them.
Absolutely.
Thank you.
Well, first thing, I would like to hear a success story in terms of these IRA funds and surviving. How to do that? How to do that? In describing, we were the winners of a large EPA grant, $500 million, such grant we've ever had, such as focus on agriculture, such as expertise in agriculture, such we partnered with Georgia Tech. They were the first, and there was lots of administration associated with it. And lots of operational challenges, et cetera. So we became the lead on the grant. And the grant was all about focusing on schools, which are looking around the I-20 corridor and such. And we know that I-20 corridor has all kinds of transportation associated with it, vans, cars, big car trucks, et cetera. And that was schools right adjacent to it. So we splashed our heads and said, how are those schools being affected? How are the youth faring? And let alone that, the communities. So we put that proposal, lots of grant, that was 3 years ago. And we finally get to Dallas in, to install systems in those schools. You know, so, we're excited about that, and somehow, some way, you know, our grant has arrived. Over the last month, 1,200 EPA grants have been suspended, terminated, you know, for cancer. You know, for some reason, our grant was the same, maybe because it's tied to, a statute, et cetera. You know, but even in the absence of funding, there's ways to sustain your programs, make sure that the communities are prioritized. You know, when this funding went away, you know, there was a huge inventory of organizations and agencies that had come together to provide technical assistance. So even though the funding has gone away, those agencies that still exist, that ecosystem still exists. So one thing that we can do is to plug our communities into that existing ecosystem, so they can take advantage of the grant writing and the financial management services and all kinds of assistance, because that sort of thing still exists. And the next thing we can do is good old fashioned community engagement, you know, and not just handing out flyers, but being assertive in this and coming up with strategies and doing this in a consistent manner. You know, such that we're educating and making our communities aware that, hey, you know, this funding maybe has gone away, but you know, this funding is still here, and this technical assistance is still exists as well. And at the same time, you know, we need to make sure that our communities are aware, you know, that because they were previously ready, because of previous disinvestment, that we have existing health disparities, you know, and we have existing asthma and heart disease and such in their communities, and we lay on top of that climate. We layer on top of that pollution. Those messages need to be preached consistently to our communities, and along with guidance towards existing funding as well.
Thank you very much. I think that kind of circles around with the comments of like, we have a great report, we have reports for health professionals here who have a very strong national message of the impacts of where we live, our zip code, the rapid climate crisis, and how that impacts our health. And so just running it to you, Dr. Ross, I have a question for you as well. I was wondering if you could tell us about the metrics for between hiring funding and justice board initiatives.
Thank you for that question. Thank you all for having me here. I am so excited to be a part of this panel. And I am so excited that we are working as a group to do something to mitigate all of the inequities that occur as a result of the fact that we have the funding and then didn't have funding. And I think that the things that we want to think about here is making sure that we educate ourselves. And by educating ourselves, what we do is we teach ourselves how to teach other people what we need them to know. And when we teach them what they need to know, then we can also expect for them to, in turn, do some action. We all know that we've all heard the statement that words without action is dead, you know. And what we want to do is we want to make sure that when we get our information out, that it's getting to the right people, first of all. But secondly, as an instructor and as a professor, you need to make sure that you're talking to people in a language in which they understand. We have a lot of abbreviations that we use. IRA is one of them. And we think that people know what we're talking about, but that's not necessarily true. And the way that we want to bridge these initiatives is we want to make sure that when we have conversations, that number one, they're meaningful and that they have factual information. There are 2 articles that you can look up that have some of this information about the IRA, but also there's information that is available to people just by looking at what it is that they're eating. I like what the doctor said a little while ago about what's in our food. What are we putting in our bodies? What is it that we're getting at the grocery store, especially at places that are in communities that are food islands? What are we getting? We're getting preservatives. Our kids are growing up on stuff that's made in a factory, not on a farm. So what we want to do is we want to educate people. We want to bring the two concerns together. We want to then also take it to a legislative point. How do we do that? Anybody can write a bill. Anybody, let me say that again. Anybody can write a bill. All you gotta do is write down what it is that your concern is, give it some facts, do a little research and put some references behind it and take it to your legislative representative. Get them to sponsor a bill. It could be something real simple. You could just start off with saying, you know what, I want to sponsor a bill about the bus exhaust. I want to know why my child is going to school on a bus, number one, that doesn't have any seatbelt, first of all. And secondly, why are they inhaling exhaust from this bus? We are actually supposed to be advocates for each other. And being advocates for each other means that we look out for each other's welfare. Well, we have to be able to do that by checks and balances. And our checks and balances are specifically and directly related to our political system, whether we like it or not. And so our legislators are the ones who we have to attack, and I do mean attack. Think about what happened. I don't know how many of you all saw Shawshank Redemption. And remember, he wrote a letter how many times? Every single day until he got attention, didn't he? We have to be relentless about what it is that matters to us in our community. We have to bring and bridge ourselves to those who are able to make a difference on our behalf. And in doing so, we will bridge both of those areas. We will not only bridge both of those areas, but we will also call attention to other areas. And as a nurse, which happens to be the most trusted profession in the world, believe it or not, Gallup's done that for I don't know how many years, but we all are responsible. Our groups, our organizations, our religious organizations, if they take a step ahead instead of a step behind, we are all in this together. We are all in this together. When there is a food island in underserved communities, guess what? That disease that they're gonna have that has to do with hypertension, diabetes, all of these conditions that are chronic conditions as a result of not having the correct things in our neighborhoods, actually domino on everything that has to do with healthcare. It increases the cost. It increases the cost. So we can decrease those elements in our community and also rise up against the situations when they take our money away. It is our money, okay? It's not their money. Where do you think it came from? It came from us paying in taxes. It came from all the fundings that are allotted to the communities for the communities to be able to do what's necessary to provide for the populations in those communities. And so I get real passionate about it, as you can tell, but I just think that we as people have the power to make a difference, and our voices will be heard if we pronounce the things in the way in which they can be heard, which means go to your legislatures. If you don't know what district you're in, find out. It's real easy. All you gotta do is Google it. Google will tell you everything. Yeah. Google, you can find anything on Google, and you can buy anything on Amazon, right? So Google it, find out who your representatives are, and then start your writing campaign. Get everybody to write. You have people in your house, they can write. And if they can't write a forum, send just an unimaginable amount of communication to your legislatures. When they cut the funding, they are cutting all of us, not just some of us. I get really concerned about the fact that we put labels and we say underserved communities, and we say communities that are not, that are underprivileged, that are not seen. But you know what? All of our communities are affected when one is affected. It is a chain reaction. It is a domino effect. And so I hope that you all will leave here today with the motivation to do something instead of just saying something. And thank you. I yield back.
Thank you very much.
If I can add also, you know, but, we need to make sure that we're continuously empowering our communities. You know, but we're not just informing them, not just educating them, but empowering them to take action and such. You know, one of the things that we did, you know, again, when you have funding, you want to make sure that you're fixing the right thing, that you're fixing the cause. And a lot of times the community says, well, you know, we're gonna do a garden. Oh, well, we're gonna help out a house. Yeah, but what's the root cause and such? So we took it on as a project to teach communities root cause analysis. Such. What happened was in a city in a city in Hampton Roads, Virginia, in a city in Hampton Roads, Virginia, they had the highest breast cancer rate in the entire state. You know, we're trying to figure out why, what's going on there. And then you layer on top of that extreme heat, you layer on top of that, you know, housing disparities, et cetera, et cetera. So what we did was we put a community, teaching people how to do root cause analysis. And therefore, when they got the funding, or they now had a basis to seek funding and such. So empowering people, that's a surefire way. Mama continues to engage to ensure the funding is going to flow in the right communities, and when it does, it's being used in that's to maximize the benefits to the community as well.
Thank you so much for that point. It's very, very powerful and important. So we're talking about, you know, words of voices, diverse voices, strong messaging. I kind of want to move the next question to the kind of the next few nodding down there. What with your work with the partnership for some, what is that grassroots organization trying to give us advocates like in the Fulton agency accountable to use this messaging effectively, and as well as the inflation reduction plans, the commitments that are promised and outlined in that. So what would you like? Bill?
Yeah. Yeah, I'm not talking to Addison say, it, you know, just understanding that kind of what was said, that there's a, I think often that people think that there's a power imbalance, there's a power imbalance, but understanding that community holds as much power, it may look different, but we have as much power as those in power, right? So your legislator, for example, I always laugh when legislators come into a room, a community room, and people are like, oh, let's recognize our elected official. That elected official works for you. You put that elected official in power, right? So you have as much right to go up to that elected official and say, this is what I need you to do. The community has put you there, the community can remove you. So you have the right to demand of your elected official whatever it is that you as a community need to do. So if you know, if this elected official or this policy is saying this is what we're supposed to do, this is what we demand that you do, or we're going to do, right? So this is how we hold you accountable. So this is what the IRS is supposed to do, this is what it is supposed to do, or we're going to demand that if something else changes. So really just making sure first to understand what's there, and I have to use this example that we saw yesterday, making sure our legislators read what they are signing on to. Right? Making sure that they understand what it is they are voting for. If not, then you gotta go. Right? And just really making sure we follow you as people, as community. And I just wanna kind of, not push back, but just really understand, and I think something that Donna said earlier, understand that words mean things. Community has power, so just kind of not, we don't necessarily have to empower folks, everybody has power. It might look different, you know, you might hold power on one hand, it might look different for you, but we all have power, we just have to organize that power in a very different way. So really just making sure that we understand what our power is, how we use that power, and use it then in a way that we can wield it and make sure that we can push back. And you understand what that looks like. Again, understanding what's in the bill. So making sure we as a community, we as organizations and coalitions know what we're fighting for, knowing what those root causes are, knowing what those social drivers are, those drivers of inequity are, so that when we go and say we demand X, Y, Z, we know what we're talking about, know what our resources are, so that we can make sure we're moving in the right direction to be able to advocate for ourselves as a community. So that again, we're holding you accountable, we know we're holding you accountable for, we know what we're asking for, we know what we're demanding. And we're not going in asking for, we're not asking for an apartment, we're asking for a whole building, we're asking for a whole development, so that we're moving power, we're moving for change. We're not just asking for crumbs, we're asking for the whole island, we're burning it all down. You can tell it's not on, so, yeah, asking for real accountability.
Thank you. I want to see if I can try to think of questions. I think I need thoughts.
Yeah, for sure. So the entirety of my advocacy, political advocacy, nonprofit career so far has been in grassroots organizing. So, to Robin's point, community is power. And I think a lot of the times we come from an individual mindset saying like, what can one person do? There's full coalitions depending on what your problem area is that you can tap into and mobilize with. Like, if you look at the fabric of American history as a whole, grassroots movement is what has caused the changes that we've seen, not just in modern history, but in the history of this country as a whole. So really being able to tap into community power, tap into coalition power, just based on whatever, again, that problem area is, like Andy, Moms Clean Air Force, insert any other coalition that you want to name. We are a group of people who have similar desires, looking for a similar goal that's coming together in order to enact the change that we really want to see. So I think that with whatever the proverbial like big bad wolf is, we feel like we are individuals in the state, but as we come together as groups, as coalitions, we can really move the needle. When it comes to environmental and climate change, there are very specific organizations from a local. I know there's many like coalitions within the city of Atlanta. There's an English African specific one, which is one community within a suburb of the city of Atlanta as a whole, and get into like the state, you get into national organizations like the one that I'm in, who have individual chapters within the state. There's ways to get tapped into communities that can create the power, create the change in a local, in the state, in a national level in order to enact that change. So I'm just all for grassroots, because we can really make a difference there. I'm sure if you were to turn to someone in a parking lot in a grocery store, I'm pretty sure you can find similarities of some change that you want to see in the community, that you all can come together, mobilize to create that power. So just realizing that it's never an individual issue. There are people who care about what you care about. And we just really have to tap into that from a community level in order to enact change, whatever that problem area may be. For me, is moms who care about clean air, who care about the climate crisis that is very, very, very real. That's a very large group of people, and it's not just moms, it's caregivers, dads, anyone who cares about the next generation of people. So we come together, there's about 1.5 million of us in this country, but 30,000 in the state. I'm sure it would be much larger if they knew who we were. If you're a mom, if you're a caregiver, if you care about kids, talk to me after, because we can continue to mobilize in the state for clean air as well as climate advocacy. So just really realizing that it's not a one-person thing. We're a community. We have desires to see a better future for not just us, but for the next generation. And just bringing that power together to really create it.
Thank you so much.
I just would like, first of all, thank you for bringing up the grassroots and being able to be involved in various different organizations, because that is important. And the reason that is important is because sometimes we feel like we need someone to lead us. And when we feel like we need someone to lead us, our organizations are indulged in that. And I think that when we think about how we can get involved in various different entities that have to do with being in a grassroots effort, that it has to begin with finding out what do I feel comfortable with. Do I feel comfortable in Girl Scouts? Do I feel comfortable in Divine Nine? Where is my comfort? Where are my people? Where are the people that I identify with? And how is it that I can have a conversation with them? It could be on around town and have a conversation. It could be that you're having a conversation about General Hospital and you bring up something that has to do with climate change. It doesn't have to be a formal exchange, is my point. It does not have to have a scheduled timing, is my point. You do not have to have a proposal written out and delivered anywhere. You can have a general conversation with someone and move that conversation forward as you move through your life, as you move through your day, as you do your giving and your doings as your days go on. So when you leave here today, you can easily talk to someone about it. It's not difficult. It's just as easy as decide what you're gonna have for dinner. You just talk to someone. We all have mouths. I always teach my students that we have 2 ears, 1 mouth, no reason. And when we open our mouth, we need to make sure that our discussion, the things that are meaningful and that land in the right place. So I do agree, grassroots is really, really important. And also, I want to also tell you that in this room, there are people that you haven't met. You're probably sitting meditating with someone that you know. Find someone young one. Learn to learn from people, because there's always a lesson in it when you learn to learn from people. One of the people that I'd like to introduce who's walking around with their facing right now is Matt Casey. You may or may not know him, but he is the CEO for the Georgia Nurses Association. And that means that he is in charge of almost 300,000 nurses in the state of Georgia. Didn't know that, did you? Learn to learn from people. And that's all I have to say.
If I could add one thing here, is that I talked about earlier, I talked about earlier the fact that, you know, when the brand is cheapened, cheapened. But it's just a grant and all of the ecosystem created by knowledge, relationships and such. The technical agency alliance technically used that grant to create 3 other projects associated. We put in schools, we put in volunteers, we put in grassroots organizations. They created 3 other projects with a single grant. So we use it as a force multiplier. You know, and now we be able to highlight the problem child, star child, but nonetheless, it's about the things projects being community led, community driven, community and empowered, etc. And then we maximizing the benefits to the community as well. Another example, we want to bring to do an extreme heat project, etc. You know, so we put people in cars, sit around, sleeping inside, they collect the data on temperature and get in the community, et cetera. If we figured out which the communities and neighborhoods that were with us, and now we're gonna come back and plant trees. Yeah, 50 trees, 800 trees in those communities. But when, you know, grandma can't wait on the tree grow, 8, 9 years old, she needs immediate help. So the grant says, you know, we're gonna have trees. So we kind of leave beyond the springs, okay? We leave beyond our requirements and maximize the benefits for the communities. What do we do? Yeah, we plant trees, but now we're also fixing ground on this irrigation side. Now we're also setting up tree protection ordinance, okay? Now we're also establishing a long-term internet that handles tree canopy and sustaining and other green infrastructure as well. So it's community led, community driven, community power that maximizes the benefits that leads beyond the grant and satisfies the needs of the ground. Okay, that's what we need to do.
Thank you very much. I mean, it's just kind of all the ideas and important phrase or words are kind of coming together. Then I just one of the questions that we have here, and getting back to your background, what opportunities do you feel exist currently or would you like to see kind of brought to fruition for nurses and clinical professionals to engage with and benefit from climate health initiatives, also focusing on the importance of grassroots movements and grassroots organizations and that.
Thank you for that question. I think that oftentimes we feel that healthcare is an anomaly, that it is a space in and of its own. When reality is that healthcare is about all things. It's not just about going to the doctor and getting a diagnosis. It's not just about getting a COVID vaccination. It's about your entire being as a person. And because of that, we are able to bring all things together as nurses. As nurses, being in that profession allows us to not only touch the patient physically, but also touch the patient mentally. And as a nurse, I have found that we also are some of the greatest educators that you ever come from. We teach about everything. And because we teach about everything, we are actually with legs, feet, the eyes, ears, nose, and the mouth, bringing information that you want to get across to anybody. And that's why I have chosen to be here. That's why I do my fellow in this work. My daughter, which some of you all probably remember from way back then, Jean Cole, created the company Rooted. And she was the one who got me started being interested in environmental arena and healthcare. And because she did that, she had nothing to do. She's not a nurse, and I had no idea what she was doing. It took me a long time to figure out what she was talking about. She was involved with SAFES, and she actually helped to develop the fly-ins where the Congress people are flying in, and especially did a lot of work in this area. And when she would talk to me about it, I would listen to her, but I wasn't listening to her from a healthcare standpoint. I was listening to her from an initiative and a political standpoint. And you ask how to bring those two together, it's called conversation. It's called conversation. Because she was on one end of it, I was on the other end of it. And she would say, oh my name is John was to Washington, we're gonna be talking to Amy, and she figured what is going on when I was like, okay. I mean, literally, I was like, okay, until I thought about it one day. She was telling me our lessons, and then she looked at me and she said, don't you know it has everything to do with healthcare too? And it was just like a light bulb. And I thought, well, yeah, it does, doesn't it? Because our health is connected to our environment, very much so. I think about all the ways that we are exposed and how healthcare is impacted by it. And I did an essay about toxic waste and runoff from use of chemicals from healthcare products. Just something that we don't think about. We wash our hands, goes down the drain. And where else does it go? It goes through the plumbing, it goes into the rivers, into the streams. All the toxins that are in healthcare products, we are drinking. And I thought about that as I was doing that expose and how much that connects both areas together. Because our health is connected to the environment in other ways too, that we don't even think about. A lot of us have been listening and frustrated with the rain that we've been getting lately. Well, it cleans the air. And we need the chlorophyll that it creates so that we can have these green trees that we look at. And we need these green trees because these green trees drop seeds in the ground. And the seeds grow more trees and they then germinate, and we can also use that so that we can grow our vegetables and our fruits and the plants that we should be ingesting, as opposed to those that are coming out of our companies and factories. And all this GMO stuff. We need to be able to understand how important it is that we are helping and that we share how we help with other people and how that relates to our environment. And how the funding that we deserve because it's our, how the funding affects what happens in these areas. And the more that you look into it, I believe the more you will be surprised. And the more you share with your families, I believe the more they will be surprised to find out just how important this really is. It is not anything short of life-sustaining. It is absolutely life-sustaining. And it being a life-sustaining issue, we have to all take responsibility and be accountable for making sure that when we go to our physician, or we see our nurse practitioner, or we're talking with someone about health mentally or physically, that we also incorporate our agendas for what it is that we're doing environmentally. In other words, what are we eating? What are we drinking? What are we exposing ourselves to? We go to the beach, and we lay on the beach, and we get in the sun. Yes, people are brown skin, we get sunburn too. You know, and so all these things come together and bring us into the same household as environment and health. So I think that many times we think that we want to put stuff in a carriage or put something in a container or a cycle. And the reality of it is it all connects together. It all connects together, and we have to make sure that when we connect all puzzle pieces together, that we're putting them in our space, creates a picture that's beautiful and beneficial for everybody.
You know, see if you have any thoughts on that, take a question on.
Yeah, I was just gonna say, I think it's really important to realize that at your core, of course, you all learn from people, you're nurses. One of my most favorite people in this world is a nurse. My mom was a retired nurse practitioner. That you are a community member first, right? So you are, before you are taking on this noble profession of being a nurse, you are a part of the community. This is a side story. My mom, she's a retired nurse practitioner. I used to be so mortified when we would go to the store and people would pull her aside and like, Miss Connie, I got an itch. Or Miss Connie, I need such and such. I was like, oh my God, I'm so embarrassed. But she was a part of our community and people trusted her to just, talk to her in private and just confide in her, whatever the issue was. And I was like, oh my God, like I wanted to crawl under whatever. But I had to appreciate, that she was a part of the community and how much she meant. It means, I mean, she's still here, not here. But I'm saying, like, just, of course, she was a part of that community, but just understanding that at its very base, that you are a part of the community. So that means that all of this impacts you too, right? So you come into this work as a community member, so you bring that to your coalition, to your work, to this, greater calling first. So you being a nurse just adds to that. So all of these coalitions need that expertise as well. So that is a part of it. So all of these grassroots organizing need you to show up that experience, that expertise. How does it look in your community? How does the water affect you? How does the air affect you? Then you need your clinical expertise, right? So of course, the coalitions that I work in with climate change and health equity, we're talking about extreme heat as well. So it's one thing for me to say, I can talk about all of these, climate-related health impacts. I can pull up all of this data, but for you to then say, yes, it's going to exacerbate asthma, it's going to exacerbate cardiovascular disease, these are the asthma and things like that. We need your expertise. So you being a part of that is really important and helpful for you again to come in with your expertise, but then also bring your community and your lived experience as well. So there are lots of places to plug in. We always need you both, wearing those hats. I'm sure it can also bolster your experience when you're in the workforce, when you're, talking to your patients. You can also engage them on conversations around climate. Because when we have these conversations for so long, You know, a lot of them are very abstract. I remember a time where people weren't thinking about climate because they were talking about ice caps, melting. People weren't thinking about polar ice caps. When you start to talk about, hey, it's like 10 degrees hotter this year. We have like how many more days are 10 degrees hotter than they were like, you know, 10 years ago or 3 years ago. People can understand that. And if you're thinking about, you know, hey, are your headaches worse? Are you a little bit more angry than you were? You know, is your asthma worse? People can start to relate to those things. Do you need your home maybe, you know, weatherized, you know, really costing more to run your air? People can start to relate to that and start to have those conversations and really think about what climate change looks like in their lives. You can have those conversations with your patients, so you can start to have that conversation around climate change. People can start to understand what that looks like in their lives, and they can start to begin to advocate. You really have a role to play in these conversations and really bringing more folks into the climate change fight. So there's a place for you, for your expertise, both as a clinician and a community member. So just don't ever underestimate the role that you can play, you know, wearing those hats as a wonderful clinician, as a trained person, but you're also a community member at your heart. So lots of places for you all to plug in. And just, you know, don't forget how important you are. Go nurses.
Before we go to Mary, question I have is, you know, such a simple but important concept. Care for children, the next generation, how that is somehow related. So with your graduate work in grassroots organizing, same question from your perspective as well.
Repeat it for me one more time.
Basically, just wondering what opportunities you feel exist for nurses and medical professionals to engage with or benefit from climate health initiatives. So we kind of took a twist and we're talking about the concepts that we've all been discussing about intersectionality, grassroots organizing, coming together as a group, all with different perspectives or just different expertise, but all on the same message. What would you feel to support you in your grassroots work coming from nurses?
Yeah, so I think it's just humanizing the issues. Like on my side of things, I do a lot of work talking to people, obviously, talking to everyday people, but also like talking to politicians. And a lot of the work that goes into that is merging those two conversations. I sit down and have conversations with moms. I sit down and have conversations with caregivers. And what's the most impactful thing when I'm translating these stories? Is actually telling people how it affects a family, how it affects a child, how it affects a mother. It's really easy to like throw out statistics. Like in terms of clean air, I was writing something yesterday, realized that there's about a 9% percentage of children in Georgia who have asthma, and that's just the diagnosed. Of course, there's way more that's undiagnosed and other respiratory issues that may not fall under asthma, and those numbers are helpful when I'm writing up a paper or proposal or something like that. But what's even more impactful when I'm going into having these conversations at a legislative level is then how I spoke with a mother who is originally from Forest Park and how she had to move her family because of the air pollution that is now a black map, if you were to look it up with the American Lung Association and other avenues that you can take to get this information, where in surrounding areas, which may be at East Point, which may be in College Park, they are able to show elevated respiratory issues, but also particulate matter. But on a specific part of the map, it's not even available, because if you were to release that information, then it would probably cause a lot of issue on a municipal level. It would cause an extreme exodus of people in that area when they realize how the place in which they live affects the health outcomes of their families, of their children. They hear about the stories, right? So I think it's being able to merge the two, like numbers are good, but actually being able to humanize these stories, put a name to it, put a face to it. I love how you show your daughter. These are real people. These are not just numbers, and being able to show how these issues have health outcomes that affect your children, that affect your family. I think that moves the needle forward. I know that when you go into doctor's offices, you usually see like charts on the wall that show like specific numbers about like what ranges like your your blood pressure should be in. If you're in a pediatric office, it shows like the levels in which a child needs to grow and all these other numbers. Like, yeah, you see the numbers and that's impactful, but how more impactful would it be as clinicians, would it be to not necessarily just share an anecdote, but share real life experiences on how these things can affect your children, these things can affect your community. So I think it's really merging the numbers with the stories and humanizing it, because we as humans are ethos-based, right? A lot of people don't resonate with a number on a screen or a number that's just thrown at you for statistical purposes. Actually being able to see, hey, this affects my neighbor, this affects my community member, this affects the children in this community, is what really moves the needle forward in terms of merging these two aspects. So that's all we do is tell stories, because that's what moves the needle outside of the numbers. We care about the numbers, yes, but we care about the people more.
I just want to thank you so much for saying that, Kaya, because stories is exactly what in healthcare we do. They're called case studies. Okay, and when we do case studies, what we're doing is we're telling a story, a true story about someone who has experienced something in healthcare and how the evaluation of it and how it turned out. And actually what the care was good. And so we have lots of case studies about exactly what you're saying in terms of asthma, in terms of all different types of lung diseases, including cancer. And these are real people, like you're saying, these are real people, real life, who have shared their stories that are now being published as a result of their concerns and as a result of their lack of good health regarding the situations that we're discussing today and in terms of environment. And so, yes, you can find many case studies. And as you were just saying with our doctor, when you put your daughter, that's a case study. And so she's a live person, but she actually has been put into a study of showing what happens. What happens when you're exposed a child to all these different things and all these different outcomes. And the child is just simply trying to grow. And so I thank you for bringing that up, making it true. It is a human thing. And the human situation turns into case study.
May I just, and we just kind of put that succinctly, so we always say stories are data, and, you know, when we talk about talking to legislators and other decision makers, we just always say that numbers change minds and stories change hearts. It's all important.
You know, the folks over here and the ones who love Rosa, we all, if I did give them a shout out, we're talking about health, funding, et cetera, and we were found two health research groups, right here, one is called Hercules, and Hercules, it's community focused, community driven, research, is a year and Emory's been around for 2 years and such. We're going to say what environment it helps steer some of the clinical research and apply. Also chart six stood up last year. It's an NIH research unit focused on extreme heat and health as well. 1.2 million brain start chart. But the IRA impact is not only affecting our communities, it's affecting these researchers as well. So when you think about policy, when you think about advocacy, when you think about what's affecting our community, and when we draw back resources, whether in terms of personnel, grants, but from these research centers, there's real people. There's delayed benefits and such. Okay, so we're really advocating for these folks as well. So give a shout out, sorry, as well. The essence of what the money's going away, what do we do? We can just go stop it for our hands. One of the things again, when we talk about this ecosystem that was created, well, you tap into that. Again, some of those entities are still existing. Example, so which app is that right now? And as a result of that, Walmart has adopted us down social venture funding and all this stuff. So again, we tap into that ecosystem. And secondly, it's time to use technology. So let's use technology to science, data science research, or whatever we're doing without gaining whatsoever. We're part of the university to create a community well-being index. So we're taking ultimately these indexes, indices, database, all that kind of stuff. Getting researchers over international laboratories, you come together, us come together, and they pay it all. But we're trying to purpose of mission, we're trying to ensure that our communities are. So we develop this community well-being index that will help managers, developers, softwares, developers, figure out what's on their communities. Not only that, if they propose development in those communities, what part of the those communities that this big box thing there, et cetera. No money. No, nothing like that. Just pure vision, pure purpose, and it's staying on for a purpose, staying on the aim. That's what we need to do.
Thank you all so much. We're coming to the end of our time, but I just really appreciate everyone's perspective and all the amazing work that you're all doing. So I wanted to just turn it back to each and every one of you to see if you had any final thoughts, call to action, conclusions, or anything that you wanted to share with the group.
I think I've mentioned in many things that I've said so far. My action is very simple. You've heard it every time you've ever turned into about anything. Each one teach one. Each one teach one. Because it causes a chain reaction. And if you share information, that information will be shared. That person know that the expectation is for it to be shared. So that would be my call to action. Each one teach one. Find your district legislators. Find your people and teach them and have them to teach someone else.
See the group. Okay, when you're up in trouble, any sort of piece of place, don't try to dodge it. See it through, okay? And that comes from pulling back, anywhere, yes, but it's all about the fact that we're in troubled times. Lots of barriers, lots of challenges, lots of unexpected things happening on an hourly basis, but we need to see it through. We need to see it through because there are populations out here who still need us. All right, so we need to maintain our aim, stay on course, and see it through.
Mine is very similar. There's power, there's power in base building, specifically. My organization advocates for people who cannot advocate for themselves right now, i.e. children. So what we're doing right now matters. Although again, it's uncertain times and the landscape of the work that we're doing right now looks way different than it did even 10 months ago. The work that we're doing is still impactful. And what we're doing right now matters. So just keeping what's important in front of mind, even when it seems to be difficult. This time shall pass, and what we're doing right now will impact the next 15, 20, 30 years. So taking the eye off of what's happening now and keeping the goals for what's going to be necessary later.
Not much different, everything has been said, but keep going, don't get distracted, and we will win.
Thank you so much again. We're going to get started with our storytelling workshop on the importance of climate storytelling, turning your lived experiences into policy action. And so again, I'll introduce myself. Oh, goodness, my name is Milagros Elia, and I am the Program Manager of Climate and Clean Energy Advocacy at the Alliance of Nurses for Healthy Environments. I'm joined today with my colleagues, Dr. Hannah Noel and Sarah Pinchuk, our policy analyst. Today, we're going to be talking about storytelling, the power of storytelling in terms of health, impact, and environment, that connection. We'll start with an introduction on storytelling. What does that mean from the perspective of a public health professional or clinician? Then we're going to break into breakout rooms, and we're going to do some activities around developing your stories. And then we're going to come back together, and for those who wish to, we're going to encourage a representative from each of our groups to talk about what their group, what sort of transpired between their groups, and what were some key takeaway points. We're going to have an advocacy breakout activity and do the same, come back together and have a report out before closing and evaluating at about 4:30. So our objectives for our workshop, the power of storytelling, is we're going to outline and explain that relationship again between health and environment, and what is the current science on climate change, including equity considerations. We're going to be learning about utilizing storytelling techniques to demonstrate environmental health impacts in the health sectors and out in the communities. We're going to identify 2 actionable steps that nurses and healthcare workers can engage in concerning environmental health advocacy. And so let's get started with that context of health and environment and connection. Remember when I spoke a little bit earlier about each and every one of you making your way in today because you have a why for being here. So thinking back to that first, as early as you can, that first major event, environmental event, climate event, environmental justice event that really occurred in your life, that impacted you in some way or form, it was like a genesis moment, that moment that impacted you and made you interested in this discussion. Now, maybe you, like myself, were too little to understand, to be able to articulate what that impact meant to you, but it still carries weight in your mind. What made you interested enough? Because I want to know, what made you interested enough to tune in virtually or get in your car and drive here physically? Where did that interest first come from? We're going to take that moment, that genesis moment, and start developing that into your story of why. So we call it the power of storytelling because, again, as our panelists had said, there is power in storytelling, particularly as healthcare, public health workers, and clinicians. And this is how we begin to advocate for change. On this slide, you'll see just a few excerpts from different media outlets on how that does show up in the media. And why am I making media a point on this slide deck? Because now, in the face of all the challenges that we have on the national level, one of the one of the voices that really needs to be amplified about this connection of environment and health is that of public health workers and clinicians. We are vastly underrepresented in the media. So being able to develop this as a skill is important. And so within the storytelling, we talk in terms of frameworks. And so one of those is the hero's journey. And can I get a show of hands, who's ever heard of the hero's journey? Okay, some have and some haven't. So we're gonna dive into that a little bit, talk about how the hero, whoever that person is, maybe it's yourself, maybe it's somebody you know that has had this experience, embarks on an adventure and faces challenges and undergoes that moment or moments of transformation as the protagonist of the story. And so we're going to look to, when we're developing our stories, we're going to be sure to define what that hero looks like in details. When we're in our breakout groups, we're going to say, we're going to look at who our group is made up of. Who are the individuals that are joining us in this while we develop our stories? What are their stories? We're going to look at values and principles and beliefs that guide that hero's actions. What defines their character? What aspirations and vision drives the hero's quest? We're also going to look at the villain, or who plays the role of the villain. And mind you, that can be, doesn't have to be an individual, that can be an organization, that can be a certain movement, that can be more of an abstract idea. Maybe it's climate change in and of itself. But that, when we're thinking about the villain, as we develop our stories, we're looking at the force, or maybe it is that individual that opposes the hero. It's the primary source of conflict for the hero that challenges their values. Who is it, when we're thinking about the villain, that is standing in the way of the change that the hero wants to create? And how and why are they doing it? We're also going to look at policies and methods for the hero to adopt and overcome these challenges. We're going to talk about Marshall Gantz's public narrative arc, story of self, us, and now. And we're going to talk about story-based strategy, Center for Story-Based. It comes out of the Center for Story-Based Strategies. So here I just wanted to introduce this quote from Marshall Gantz. Leadership is accepting responsibility for enabling others to achieve shared purpose in the face of uncertainty. And I really feel that in this moment in time, as it intersects each one of our personal experiences, never before has a quote resonated so deeply, at least with me. Each one of us in this room is called to be a leadership in whatever way, our professional lives, whatever we are with our professional lives, and personally as well, as championing environmental health within our communities. And so, however we accept the responsibility of being a leader, we really need to rise up and help others who with the same value set and with the same concerns, find our purpose together in the face of these uncertain times. And so now I want to talk a little bit about what does this have to do with narratives and stories? So when you are faced with uncertainty, when things are just not clear, There are two ways we try to understand the world. This is everybody. We use logic and we use emotions. Emotions require a different type of language of the heart. And this brings us to the power of storytelling, because that is what storytelling taps into, the language of the heart. In order to take action through shared understanding, we need both the facts, the logic, right? The facts, and we need that emotional capacity to make choices, to take action. Look, in our field in public health, we are so focused on evidence-based data because, of course, we need the data, right? But we cannot neglect the other side of the equation, that emotional element. That is what drives people into action. As human beings, we experience certain moments. We create emotions around that experience, which in turn brings us to creating action. So today in the stories, as you share these moments with each other, and as those stories resonate with each other, and thinking out into your group outside of here, your families, your neighbors, the places and spaces that you occupy, how those stories resonate with other people, and how do we create motivations to move people into action based on those emotions that we attach to those stories. It's important to acknowledge now that we're looking at that emotional element, that there are emotions that motivate and emotions that inhibit. And so when we're creating a story, we want to be very clear about how to leverage action inhibitors and action motivators, or how to utilize those in our stories and the part each one plays. So under action inhibitors, think of someone who is apathetic, who is filled with fear and self-doubt, and maybe who is experiencing or feeling isolated. That person that I've just described is not likely to take action in any which way or form. Action motivators, there's somebody with a sense of urgency. Maybe they feel angry. Maybe they feel hope. There's a sense of solidarity. They feel that others belong with them on their hero journey, that they are experiencing a universal truth. They have a sense that they can make a difference. So when we begin to understand those two polarized types of emotions, the inhibitors and the motivators, when you want to encourage and influence others into taking action, these are things you want to consider when you're thinking about your own stories. Which of these played a part? At what point were you filled with fear? At what point did that fear maybe become anger? And were you able to transform that anger into a sense of urgency? Or did you find people who experienced similar events and there was solidarity, and maybe that spurred you into action? There are elements of both in each of our stories. So when you think about that for yourself, as you begin to develop your story for others, you want to place that into your story. With urgency, anger, hope, solidarity, you can make a difference. When we're telling stories, we're trying to encourage people to feel those emotions. So this may sound very rudimentary, but it's important to break down this word that we all think we totally get the gist of. What is a story? Why does it matter? When we tell stories or relate our life experiences, it's the format through which we translate our values into motivation to act. A story is crafted of just 3 elements: the plot, the character, and the moral. Every story has those 3 elements. The effect of the story depends on the setting. Who's telling the story? Who's listening? Who is your audience? Where are they? Why are they there? And when? So all of these elements need to line up. If you don't have a shared experience with your audience, they're not going to resonate with your story. So the audience needs to match the teller of the story. It needs to make sense. Now we're going to talk about the components of a story. If you reflect on stories you've heard or remember most vividly, and that could be something from your childhood, one of the stories a mother's read us at bedtime, or teachers talk to us at school, or a personal experience, you'll remember vividly that there are certain similar structural elements. Remember those 3 elements that I talked about before? That is, stories are always crafted with those 3 elements: the plot, the character, and the moral. The moment of choice, characters, moral outcome, plot, challenges, choices, all of these communicate in some way or form values through talking about emotions that were experienced through the challenge that the audience resonates with. But even if it was Little Red Riding Hood, when we were little, right? Girl got lost in the woods. Do you know how petrified I am of getting lost in the woods? I can relate to that. So that was my hook. Then the wolf appears. Who's the wolf in your life that appears? You're not really sure. Can I trust them? Can I not trust them? Yes, it's a storybook for a child. But I think we can all kind of see how that might relate if you personalize that to our lives now or even then. And then the challenge that, in thinking about your audience, when you've walked them through those emotions, the challenges that resonate with them. Ultimately, rather than just telling a story, you want to be able to tap into the challenge, the choice, and the outcome. Because otherwise, we're just reading from a page and we're not touching that emotional center, that heart center with our audience. What is that challenge that they would understand? What is that choice that needs to be made? And what is the outcome? The story begins with a challenge that confronts the character and demands that they make a choice. And this choice yields to action. So now let's move into what is a narrative. The stories frame our understanding that shape how we perceive and act in the world. It helps us to make sense of the world that we live in. It influences us as individuals, and it influences public opinion, policy decisions, and it drives collective action. So when we're looking at our own personal stories, using, for example, climate change, what is a climate story? How do you make that into a story? Starting with your personal self, what is that intersection of your life and climate change that you identify maybe with your culture, your family, your response to what was happening, your emotions and your observations? So we begin to look at crafting that story, and I ask you to start thinking about that moment when it became impactful for you. Use words, even if it's just mentally, like, I remember when, or I've observed that. You can even say, I feel that, I'm thinking about, I'm worried about, I'm excited about. Maybe you could even say, I'm starting to get involved with. I'm talking to people about, our panelists talked at length about the importance of communicating and engaging with our communities. So what are you talking about to people about? Not just when you're behind a podium, but in the supermarket, when you go to your neighbor's house, when you're out for drinks with friends. How are you planting those seeds? A climate story uses specific details and sensory descriptions. You want to paint a picture for the mind. You want to show, don't tell. Everyone has a climate story. You have something to share from your perspective, and we're going to delve into that today. And to help us with that, because sometimes it's an image is worth 1,000 words. We actually have a video of a person sharing their story, and that'll help maybe give you a little bit of contextual information. And why is it important to share? We've talked about that before. We can't underscore how climate change is typically communicated through data, but nothing is ever going to mobilize people without communicating that data, translating it to personal perspective.
The hospital that I work at is in a more rural area. It's a small community hospital, only 8 beds in the emergency department. I was seeing a lot of people in their 40s come in. They're pale, they're diaphoretic, they're saturating in the 70s, they can't even talk. When people come in and that's how they're presenting, you know, at this point we all know, oh, that's COVID. From my own perspective, from what I saw, that half, maybe more, were in fact not elderly people. Being an ER nurse, I was terrified for my kids. I sent my kids to my mother's for 3 months. I missed my son's birthday. I missed my son losing his first tooth. I sent my kids to my mom for 3 months. I didn't see my kids because I was that scared for their welfare. I had one experience where a young individual with no health problems, who was my age, and I'm 33, they came in and I literally watched that person die over the course of a few hours. That really stuck with me. We are the most trusted profession in this country and have been for quite some time. We need to live what we preach. I actually work with some nurses that are hesitant and have declined to take the COVID vaccine. I mean, hey, I used to be one of them. I was hesitant. I initially didn't want to get it. I'd seen a lot of young people admitted to ICU, intubated from COVID, and I wanted to be there for my kids. This is a vaccine. This is a disease, you know, COVID. It's not politics. Vaccines have saved millions and millions of lives across the globe. With my first shot, I actually FaceTimed my kids. I FaceTime my kids. I wanted them to see me getting the shot, to know that there was nothing to be afraid of with needles. There was nothing to be afraid of with this shot. About 3 hours after I got it, I had a mild headache. I only felt kind of fatigued for a day. With my second shot, I was texting my mom saying, look, here's my card. That was really important for me to be able to show her, like, look, I did it. I'm a nurse. I did it. I'm still here. This has been an extremely long haul. To cross the finish line, to get some sense of normalcy, we need a high vaccination rate within our communities. The fight's getting better, but it's not over. We've managed to get this far. We're almost at the finish line. We can do this. We're gonna finish strong. We can do this.
So when you're looking, we just heard her story. What sort of emotions did she create for you? Maybe if you're a nurse like I am and remember what it was like to work in COVID, during COVID in 2020, maybe that was a point of connection. Maybe you were part of the public. And remember that fear factor when the vaccine first came out, there were many, many people who were hesitant to take it, that they weren't sure. Remember, it had been pushed through the FDA so that it could be made available. And there was a lot of people that had fears about that. Maybe you were a patient, maybe you had contracted COVID. So just from hearing her story, she was a mom, maybe you're a mom. And you can relate to all those fears that, what about my family? What if my children or my mother gets sick? When you think about the emotions that hearing her story elicited, how did she create that emotion within you as the listener? How was she able to resonate with you? What did you learn about her in listening to her story? And as you think about that, also start to think about the connection to our work with the public. In using her story as an example, begin to think about why outside of her story, with the million other stories that there are out there, why are these important to our work? How does that impact the work that we do? Some of us are very niched. Before I came to work from Annie, I was an oncology nurse practitioner. So how do these stories impact my patients in cancer care? How do these stories of environments and health, climate and health, impact maternal health? How does it impact public health through infectious disease lens? How do these stories impact your space in which you work? So now we're going to move to that public narrative, the story of self, us, and now. When we turn to storytelling in organizing, to answer the question of why we care, why the work that we do matters, why we value one goal over another. Storytelling allows us to communicate our values, and in organizing, we use the stories to articulate that shared value. Stories can be a source of inspiration. It means to engage and connect with one another, and most importantly, a way to motivate others to join us. Stories help us to find power in our voice. I have heard tell many a person say they are not public speakers. They do not like it. But if you're sharing a story, it suddenly isn't so hard because it's yours. It was born out of you. It doesn't require you to spit out data or talk about things in a greater sense. You can tell your story, and some people find it easier to do that in writing, in speaking. However you find that you can do that, know that there's power in that. Being able to share our story develops leadership and organizational skills. Bit by bit, we begin to connect the dots for others. It just makes campaigns more powerful, relatable, and memorable. It allows us to ultimately reclaim the narrative. It builds bridges, and really well-told stories compels listeners, compels them to join you in that conversation. So the story of self, starting with that, these are the values that hold you to leadership. Story of us are the values and shared experience of yourself and the community, yourself and the group that you belong to. And the story of now are the urgent challenge to the values of us that demand action now. Some of us may think our personal stories don't matter. The others won't care. Or maybe we've been told we should not talk so much about ourselves. But on the contrary, if we do public work, we have a responsibility to give public account of ourselves, where we came from, why we do what we do, and where we think we're going. In the role of public leadership, we really don't have a choice about telling our story of self. If we don't author our story, others will. And they may not tell our story in ways that we may like, not because they're malicious, but because they try to make sense of others by drawing on their experiences of people who they consider to be like us. So whatever that like us bucket is that you fall into, that's what they're thinking. That's what they are connecting to your story. So best that you tell your story. And I'm going to hand this over now to my colleague, Sarah.
Thank you, Millie. All right, so Millie set the stage for an activity that we're going to be doing this afternoon. And we had a panelist this afternoon who said a really great quote. She said, "Data changes minds and stories change hearts." So what we want you to do is think about why you came here today. You know, was there something climate related that made you think, I want to go to this conference? Maybe it's, you know, something in your community, something you've seen. And think about when you first cared about being heard about this issue. We also want to think about, when we think about that, you know, what inspired us? Why did you feel you had to act? And what did you do? Maybe what you did is you came here today. Maybe that's the action. And if you have an outcome of it, you can list that in your story and you can include that in how it felt. So shortly, we're gonna, actually right now, you should have little notebooks on your table for those of you here in person. We're gonna have small time to ourselves. We're gonna have about 5 minutes and we're gonna craft our story of self. So we're going to think about the moment in your life that made you care about what we're talking about today. And also, what values that evokes. Yes, yes. So this was actually Robin Boosie said this at the end of the panel. We had such amazing panelists. And she said, data changes minds, but stories change hearts. And that's something that really stuck with me from today. So, we really want to we have a lot of data in nursing and in public health. We have a lot of facts and information, but we know that isn't always communicating the issue because people connect to each other on a personal level through stories. So I'm going to give everybody about 5 minutes right now, just at your table by yourself. If you want to jot down, what you think your story of self is. And this is really important because in order to communicate to other people, and we'll have a little activity after this, we have to first realize where we fit in the story. So I'm going to give everyone 5 minutes now to just jot down, and doesn't have to be an essay, it doesn't have to be a full story. It can be bullet points. It can just be, why you came here today, and you can just keep it to yourself. So I'm going to give you 5 minutes starting now. And for those of you who are online, you can just do this yourself as well. And we will reconvene in just 5 minutes. All right, thank you everyone for working on that. We're gonna come back together. So I know we have about 15 folks online. And now that we've worked on our story of self, I want you to think about the story of us. So when you have a story of self, that's something that motivated you. But when we need to motivate other people, we need to think about how our story connects to the community and what values we share with the community. So we want to think about points in our story of self, choice points where we're motivating other people to act. And we're trying to describe to other people about the choices that we've faced and have them think about that. And we want it to be compelling, and we want to lift up people in our stories to give people hope. So shortly here, we're going to do our story of us. And what this is you're going to take your story of self and you're going to think about how we're going to connect this to the larger community. So why is that story that we just worked on important? And what are we actually asking people to do through this story? So in your story of self, we're also going to include the story of now. We're going to explain why it's urgent. It's going to bridge your story to how we can act. You notice that in our panel today, everybody ended with an action point, something that we can all do. So we're going to connect our story of what motivated us into how we can connect to the broader issue. And one of the things I want you to think about when we do our breakout in just a minute here is how we can describe to other people what will happen if we fail to act. So we all came here today around climate action. So we need to really describe to a broader audience what happens if we don't do this. So I want you to think about giving a specific and concrete way to take action. So now, well, I hope you took away the importance of communicating why something is important to you and the broader community. This is all of our emails. We do encourage you to join Annie as a member if you aren't already. It is free. You do not have to be a nurse. We have a number of different social media handles. We're on LinkedIn, Facebook. We are still on X. We have Blue Sky, Instagram, and we are on YouTube. And we have a new learning site. If you want to go there, there's free CE for nurses. And there's a lot of really great educators and speakers on there, all for free. So we really appreciate everyone who joined us in person today and also those who joined online.